many diseases that killed plenty of soldiers during the Civil War, World War I, and World War II. The main types of diseases were dysentery, typhoid, egg, and yellow fever. Dysentery caused the victims to get severe diarrhea with passage of mucus and blood. The typhoid fever, this disease caused it had several bacteria. It was severe, that caused high fever, intense headaches, and intense rash and delirium. Egg caused a bad fever with a cycle of chills and sweating, which is also known as swamp fever. Yellow fever was caused by a virus. This disease is carried by a specific mosquito and can be fatal. There were a whole host of the Civil War diseases during the war. The worst disease was dysentery. This disease accounted for 45,000 deaths in the Union Army and 50,000 deaths in the Confederate Army. The reason dysentery and so many other diseases were able to spread so rapidly through both armies was primarily a lack of sanitation practices and contaminated water.
The first antibiotic was penicillin. It was created by Alexander Fleming, who helped promote it and discover it throughout the war of World War II, which was used for the excess clinic trials. How did he discover it? It was discovered by Fleming, who saw colonies of Streptococcus, a bacteria, on one dish. There was mold growing in the zone, and the mold later identified as a rare strain of penicillin. The impact of penicillin on people, it gave the people something to fight against bacteria and ear infections to help them and keep them from dying at young ages and be able to live longer. And what did it kill? It basically killed ear infections and bacteria that was caused by Streptococcus.
During the Civil War, the experience and training of doctors wasn't well regulated. Civil War medicine was behind the technology that caused so many deaths. Since sanitation was non-existent during this period of time, any type of open wound would become easily infected, leading to severe complications or even death. There were many different Civil War diseases, and if you did become sick, and every soldier did at some point, there are a lot of interesting techniques Civil War doctors would use to treat your illness. The Civil War medical instrument used during the Civil War would most likely do more harm to you than actually help you. Substances such as mercury were used often as a treatment for all sorts of problems. If you felt sick, they gave you mercury. Well, they gave you something called calomel, which was nothing more than honey and chalk with mercury mixed in it. Infection was a huge problem, and to make matters worse, doctors thought the pus that came out of it was a good sign, and they transferred it from patients who didn't have it, so they infected another patient. Probably the most recognizable and well-known piece of medical instrument during the Civil War was the bone saw. It was used to cut off the arms and legs and feet or hands. A full 75% of surgeries in the field were amputations. The chloroform that they used allowed Civil War surgeons to perform their operations without a wild-eyed screaming patient on their table.
Ways to prevent from getting infections and how antibiotics work in your body. Washing your hands, covering your face when sneezing, getting antibiotic shots, and going to the doctor helps you to prevent from getting infections, and how to understand how antibiotics work in your body. They work by affecting things that bacteria cells have but human cells do not have, and they're put in by shots or even taken by pill tablets. Why are they so important? It helps us to cure people from dying at early ages and sicknesses and other diseases that are affecting our people. And 5 antibiotic diseases and cures that have come out including penicillin. Penicillin, which cures skin infections and ear infections. Monosaccharide, which cures and treats soft tissue and infections. Fluoroquinone, which cures skin infections, urinary tract infections, and respiratory infections. Specialis, which cures strep throat and staph infections, and aminociliosis, which cures infections from negatively grammed bacteria.
The bacteria that played a major role in the loss of soldiers came from poor hygiene, overcrowding of soldiers, the bugs that were around them. These were examples that took place in a common camp during the Civil War or any war. The poor hygiene, the Civil War soldiers didn't get a daily shower. They also used a few pots to cook food and boil lice-infested clothing. The overcrowding was because of close contact with other people that caused diseases which would spread rapidly throughout. The bugs, such as flies, mosquitoes, ticks, lice, maggots, and fleas, were abundant and they carried disease. The lack of medical knowledge, people didn't know about germs and how they were spread. The doctors didn't wash their hands before operating or cleaning tools after each patient had their surgery.
What is antibiotic resistance? It is a natural phenomenon where the bacteria can resist and survive against antibiotics. Why should we be concerned about it? Because we have no way of fighting them to cure them and treat them after the fact they are resistant to the antibiotic or drug we are taking. Why are bacteria becoming resistant to antibiotics? Because the bacteria changes in a way that has a reduce or elimination that affects effectiveness of the antibiotic and drug that you are taking at the time. And ways to present resistant to antibiotics is to take a test to make sure you're using the right antibiotics for what sickness you are having at the time, or don't take antibiotics unless your doctor prescribes them to you, so they are effective to what sickness you are taking. And then several ways bacteria become antibiotic resistant is antibiotic resistance occurs when bacteria change in some ways that reduce the elimination or effectiveness of drugs, chemicals, or other agencies designed to cure or prevent infections that bacteria survive and continue to multiply, causing more harm.
The most important medical advances throughout the war were that at the field or tent hospitals, the surgeons actually used their fingers to search for bullets and try their best to actually control bleeding. And believe it or not, that 3/4 of the surgeons' times were actually spent amputating limbs. The amputation was the wounded soldier's best chance that they had of survival. The sooner the amputation was performed, the better chance of survival. If the amputation was delayed more than 48 hours, blood poisoning, bone infection, or gangrene would be set in and the death rate would be doubled. The hand hygiene was a common practice that for medical practitioners in the field of the Civil War. Germ theory, antiseptic, medical practices, advanced equipment, and organized hospitalization systems were virtually unknown. The medical training was emerging out of the heroic era, a time where the physicians advocated bloodletting, purging, blistering, while rebalancing the humors of the body.
What are the names of some diseases and bacteria that have become antibiotic resistant? Gonorrhea and streptococcus. And what are the dangers of these? They can spread faster than you can kill them because we have no way of killing them. And why do they spread so rapidly? Because basically you can't kill them completely off, and we can't cure them with any of our antibiotics because nothing is strong enough to fight them. How can we control this problem possibly in the future? Trying more research and using the technology that we invent farther along, maybe fight them. In the future with antibiotics resistance, can they be more or less of a problem? I say more of a problem because their bacteria are going to keep changing and getting harder to cure over time. But as long as we keep having our technology up to date, we should be able to fight them and cure them.